Thank you all to join my audiovisual classes. Yesterday I have dealt with the how to take a case and also direction of the animals given in different cases like epidemic, endemic, sporadic, acute and chronic. I think clear to all. Today we start because Hanuman, yesterday I have told you the next duty of a physician. Topic one, next duty of a physician, in which I think about that after completing the case taking, a physician what should be done? क्या करना चाहिए उसको? This is vital point. Next, the first duty of physician after arranging the symptoms and completing the late deficiency or any lacuna or any incomplete word, that should be completed first and revise them thoroughly, that must acquainted with the proper history and try to understand about the patient, in which I have said that to observe their attitude, observe their behavior during talking, manner, sitting manner, etc. Now, the next duty of physician starts after finishing the case taking. That is two things, analysis and evaluation. Because you know that homeopathic based on principle individualization. Individualization is the pivot of our homeopathy. Where you prescribe individualization come first. Individualization come first. So how to individualize? If you not go through the proper case taking. What do you mean analysis? I think you all have done lab work in chemistry. You have done salt analysis. What do you do in salt analysis? You are given a salt compound and you separate them. It is sodium chloride, it is sodium chloride, whatever. Then it means you have taken a case in a bundle. Now you have to separate all them in page. सबको पेज में अलग अलग करना है. तो मेरा पेज क्या है? मेरा पेज प्रोपोर्टाइजेशन क्या है? Complete symptom. Arrange them. Arrange according. First thing, what is understand? Location. First thing क्या है? Location. Next thing is extension. So search out the symptom related to the location and extension. Thereafter, sensation. And lastly, modalities is aggravation, amelioration, which are studied, time modalities, circumstantial modalities, and situational modalities. कल बताया मैंने कि that should be it. And lastly come the body essence, complete symptom, concomitant or accessory symptom. Concomitant symptom, accessory symptom are separate things. Suppose that you are suffering from headache and along with headache you have vertigo. It is associated symptom. सर दर्द के साथ चक्कर आ रहा है, ये एसोसिएटेड सिम्टम हुआ या एसेसरी सिम्टम हुआ. बट व्हेन you have profuse menses during menstruation time, at menstruation time develop collar-like symptom. Concomitant means the symptom which are appearing along with the main symptom, but they are not anatomically, physiologically related. As example, menstruation is the female genital organ, diarrhea is digestive organ, headache As soon as headache increases, urination increases jasmine. So such symptoms are very important. Buddhism said this also denote the person as a whole, in which he mentioned the new term concomitant and give highest value. So these are the point on which you have to analyze. Along with depend upon the angle of prescription. हम किस एंगल से प्रिस्क्राइब कर रहे हैं, सिम्टम तो ले लिए. What are the analyze the characteristic symptoms? Pick out what are the characteristic symptoms. Thereafter, which symptom related to the constitution, which symptom related to his mind, which related to his general symptom, which symptom related with the modalities, all are separated in different place. So, analysis done on the basis of prescription. Pathological angle, totality angle, totality characteristic angle, miasmatic angle, etiological angle. So this is the method to how to analyze symptom. Next duty, just how to analyze. These are the points I have given to you for analysis. On this point, we analyze our case taking. After analyzing, arrange them according to the schema of repertory, according to the highest to lowest value. Which symptom give highest value? Right in top, and which symptom giving lowest value in the bottom. After arranging, this way they can easily to find, because as you have told you, in case taking, we ask about the particular complaint. Which complaint is first? Definitely. And after, we never disturb the patient at all. And patient say according to his intensity of the complaint. Thereafter, after completing the narration of the patient, then we ask few questions to complete their symptoms which are incomplete. Patient may left the view, so we complete them according to the need of the repertory, like location, material, complete symptom. After that, we try to find out, arrange them, which symptom have highest value. Then come from particular to general, according to Kent, according to Bonington, and according to Kent, general to particular. Both have two schools, alright. But we start case taking from particular to general. It is quite a matter of disturbing that some patients suffering with severe chronic pain, and we ask him whether you have chronic pain from at night, morning. This is the related job. We pass it to them. He become irritated. So we start from, because you have to make a relation from patient that I am your own person, I am very close person, I am not. Then can he agree to say every thing about either that is privacy maintain. तो उस हिसाब वो बार बार बोलेगा तो ही बोलेगा ना, तब वो सब बताए. तो पहले पार्टिकुलर से जब पार्टिकुलर कंप्लीट करते हैं तब हम जनरल पूछते हैं उससे, डाइट, रेजिमेंट, लिविंग, लाइफ स्टाइल, etc. So here the analysis always done according to importance of symptom, from higher to lower. Alright? Next point for
Sir, so how can you evaluate that which symptoms is having high grade
high grade.
and which is
Because
low grade?
then evaluation start. Suppose that you gave it 14 symptoms. The first, which symptom have written in first chapter? Particular, I have said headache in which time, where is located, how, where it extended from occiput to eye or eye to occiput, vertex.
Those symptoms which is most troublesome to the patient.
But first, but I have to analyze. These are the common symptoms. These are the common symptoms. Common headache. But I have nothing to do with the headache. I want to search what is particular in headache. Headache, one-sided or whole, how one-side start suddenly, he become crazy during pain. This is a very peculiar symptom of individual. Suppose that sometimes during headache become manic, like sinus fever. So these symptoms, patient suffers from common headache. He does not know about that, but when ask him how your headache has started, from where it has started, from where it has extended, during headache, how do you behave? Become angry or weeping? These are the highest value question. This is the individual symptom about the patient. So we always like individual patient symptoms, right? Then we can evaluate. So according to piety, say give mental symptom highest value, then we give general symptom highest value, then go to particular symptom. But sometimes in acute particular become important. In chronic, from this way. In acute case, we see particular only, particular location, sensation, modality, extension. Along with this, any individual symptom during a care. Suppose that if a person come to you for colic, better by pressure, bengi double, hot fermentation. If you go in repertory, you find so many medicines for that. As for example, very difficult to differentiate colocynth and macros. Very difficult. Only one symptom differentiate that colocynth is irritable during pain. Macros is not irritable during pain. So, is irritability how you read? कैसे पढ़ोगे? By asking patient, observing the behavior. So this is the main, that here irritability during colic become highest value. Clear? So this is the way to analyze either in acute case or in chronic case, that which symptom is more important. Because your case is mixed up of common, uncommon, every symptoms. But you have to sort out what is uncommon, peculiar characteristics. In symptoms, what symptom? Symptom, complaint as a complaint, as a modalities, or other symptom, associated symptom, or concomitant symptom. So this is the way of analyzing. So you have told about that. How to analyze? Analysis on the general symptom, analysis on the totality of the characteristic symptom, analysis on the basis of pathological symptom, analysis on the basis of etiological basis, mathematic angle. So this is the way how to analyze after completing the case. I think clear all.
Yes, sir.
Right. Take some, I don't know.